Okay. All right. Well, let's hop in. It's wonderful to meet you, Kevin. Thank you so much for taking a minute out today. I appreciate
Oh,
it.
yeah, no problem.
So, before we really get into your work in earnest, I think my first question is something that affected all of us in a profound way, especially in the world of healthcare, and that was the pandemic. How
Uh,
did you get through that COVID era, and how has it changed and shaped the way that you work and live today?
well, I did actually fairly well during the COVID era because my wife and I are both physicians, and we got vaccinated very early on. I did get COVID, but because I had been vaccinated, I didn't have a very severe case, so that was real positive. And what's really sad though is the number of people that are around us that actually had some problems. And in particular, I have one really close friend, and she has all the lingering problems that are associated with COVID, with related to her breathing problems, related to memory, related to all sorts of problems that she's having. And they all seemingly are related to COVID. So I think, what's interesting about it is that we got through it, but I'm concerned that we didn't learn the lessons, which are the speed with which a virus like that can spread, that it can cause pretty massive destruction. We're actually seeing the beginnings of another potential COVID right now with the Ebola crisis, which I don't think enough people in the United States really quite understand. But literally over the space of, I think it's like 4+ weeks, we've gone from no cases to over 1,000 cases in Angola. That's a very significant, steep increase. And what's particularly bad about it is that we've had some international people who were visiting there who've been infected. They were traveling on a boat with a lot of other people, so who knows what happens there? And diseases don't pay attention to borders. And so it's inevitable that it's gonna start to spread because it's a very infectious disease. It's as bad as COVID.
Wow.
Yeah,
Yeah, and that just opens up my mind to a lot of, there's levels of politics that go into all of that, even with COVID. I remember that office that Obama had set up that was kind of monitoring levels of, the
right.
SARS and the COVID 17 and 18 was dismantled. And right now we're seeing levels of healthcare oversight that are getting dismantled. And that's the fear of all of this is that a lot of these things are preventable if we would allocate resources to monitor and better prevent. It's just
Right.
that's the thing that gets me the most out of it because the viral nature of being a human and catching things is always going to be there.
Yeah.
But
Always.
we've been around long enough with medical advancement to be able to get to a place where we can abate that from happening.
That's right. That's
So
absolutely right.
so let's get into the good work that you're doing today. I want to put you in front of 13-year-olds at Career Day. And one of the kids wants to know what you do for a living. How do you synthesize your work to make sense to their brains?
Well, let's see, for a 13-year-old kid, first of all, I started thinking about going into medicine when I was in the sixth grade. And I gave the sixth grade graduation address before we went into junior high. And my name of my graduation address was Onward and Upward. And basically, that's been a theme that I think has been resonating in my brain for a long time. And um, medicine is a career that really has the potential for making a difference, not only for individuals, which is very, very important, but also for the broader world, like we were just talking about, related to developing strategies, solutions that address major global problems. So I found that career, from my standpoint, was very attractive. I did have a slight what should I say, detour at one point during high school where I thought I wanted to go into theater. But my mom gave me a serious conversation when I came home one day and got me back on track. You know how parents are.
Yeah, for sure.
So I studied and studied hard and was able to get into medical school. And one of the things I did is I did practice for 12 years. But I would also say that I then shifted away from sort of day-to-day practice and really started to work at the more global level in looking at the healthcare system. And as a result, got pulled into management positions. And so for a good part of my career, I was involved in managerial issues related to healthcare in how to solve those problems. And we have many issues that are facing the country. I mean, let me just give you one example that's pretty big. The percent of GDP that has been consumed by healthcare until about maybe a decade ago was about 12.9, 13%, which is, a chunk of the GDP that's pretty significant. But what's really troubling is that it's projected now that by 2035, which is only a short 9 years away, that we are going to be at, get this, 21.9% of the GDP.
Wow.
And my contention is that there's no way that the economy of the United States can tolerate a quarter of its, economic activity going into the healthcare area. That we really need to address the issue. So that the issue of how are we going to fund programs, how are we going to support services, et cetera. And as we were just talking about a little bit ago, how are we going to make sure that there's equity so that people in rural areas have access to care as well as those of us who live in more urban areas. There's a whole bunch of issues that need to be addressed, and those are going to be addressed not just by managers, but by individuals who understand the clinical side and know how to deliver care as well as the management side.
A lot of the healthcare, it's amazing. I think about the infant mortality rate
Yeah,
that the United States has is like below Cuba. It's like very, very low on the list. If you statistically break down some of the healthcare delivery, we're not like in the elite class. And I think about that. That astonishes me. But it's like we have a different ideal here in America versus Europe. Like in Europe, there's bikes and there's not weight issues and everything's not oversized and oversoded. And, there's a lot of those things that are
yeah,
contributing to that GDP number being so high. Like there's not a level of preventative here, or there's not a level of that just being a part of our lifestyle. So my
right.
question to you is this: do you see anything changing potentially in this country that would allow us to get to a healthier place where that wouldn't be the number?
Well, so I take a big deep breath because our current Secretary of Health, I think, has derailed us on that function. Um, I really believe that, if you remember back, well, maybe you don't remember because it goes back a ways, back to the Lyndon Johnson era and the John F. Kennedy era,
Yeah,
um, where that's where we were encouraged to exercise as part of recess.
yeah,
And, everybody was doing it. And it was a part of a national program to make us healthier. And it worked. I mean, in fact, that generation really, I think, has made a difference in terms of healthcare. At the same time, that kind of effort has sort of dissipated, and we don't have initiatives like that. And yet, it's been shown very clearly that if you get the whole country moving forward in a certain direction, you can really make a difference. And I think that that can happen in healthcare.
yeah,
It's like with the new GLP drugs that reduce obesity. And it's very clear that they have a fairly significant impact. Well, if we make those available to individuals and monitor them appropriately, and they lose that weight, they're going to be less of a problem, down the road. And so there's a number of things like that that I think can happen at the national level that are just missing in the present environment.
Yeah. So take me back to your childhood. Are you from Maine originally?
No, I'm originally from North Dakota.
Okay, that's right. I'm sorry. You are from North Dakota. Okay. So
Yeah,
I didn't know how long. So Mike, I'm curious, when you were a kid, what
yeah.
gave you this idea of wanting to get into medicine so early on? What did you see around you? What were the seeds that were planted?
Well, I think part of the seed that was planted is that, um, first of all, my parents wanted me to go to college. So, and they were constantly, as a little kid, after me about, well, what do you want to do when you go to college? And I started looking at the various options that were out there. And I thought, I really enjoy people and I like taking care of people. And maybe, maybe I'll go into medicine. So that's how it all got started. And then I ended up working as an orderly in high school. Um, I took care of patients all the way who had, pretty severe Alzheimer's disease to crippled individuals to, people that were very healthy. Um, and found that, at least in my experience, and I think that this is something that's an important part of medicine, is that it wasn't just the technical skills that I brought to the table, it was the interpersonal and helping individuals. And I got a lot out of that personally, but they got a lot out of it as well. I mean, like one of the patients, she mistakenly thought I was her son, Stephen. And so whenever I would show up, she'd say, "Oh, Stephen, it's so good to see you." You know? And, and she had dementia, but she really was waiting for me to help her do certain things. And so I think that that's how I got into the field. And then, you know, slogged away with calculus and organic chemistry and all the other requirements that are part of getting into medical school.
Yeah. My day job is in IT, and
Uh-huh.
sometimes in IT,
Yeah.
there's people that get so excited about it they can almost imbue a God complex. And I always think if you really focused on anything, whether it's technology or otherwise, you could do these same things. But I think medicine's a little bit different. How have you always kept yourself in check with getting complimented and being at that place where you can save lives and make a huge, deep, meaningful impact to give people decades to live longer? How have you conceptualized that philosophically in the way that you've lived?
Well, I guess I've conceptualized it like to be calm and accepting and to recognize that the reason that I get feedback is that I've made a difference in somebody's life. And for me, it's not so much about getting praise as it is that I've made a difference, that I've helped somebody, and that I get a lot of personal satisfaction out of helping individuals, with their personal problems. Even today, I mean, you know, uh, I actually enjoy solving problems for people. And that's part of what I've done with my career, actually.
So, I think about living in this modern era. Like, I think about like the pandemic. If the pandemic
Yeah,
happened in 85, we wouldn't have been connected. We wouldn't have had all these technological gadgets. We would have been a little bit more separate. But I think just in general, I'm 53. I come from that Gen X place. And I
right,
think about we came from rotary dial phones to
right.
Jetsons phones in our pocket that can run anything and everything. But I think about that with medicine too, how far we came. Like books that I read from the early 1900s, the archaic way that tonsils were getting taken out. I mean, I have a jazz radio show. One of the biggest jazz musicians of all time from Kansas City was Benny Moten. Count Basie took him over, but he got a tonsillectomy and he died because he bled on the table. And I think
Yeah.
about all of these medical advancements, where we're at today. Do you sometimes just lean back in an existential moment and think, my God, we've come really far as humans with the way that we deliver medicine to people?
Oh, we have. We've come very, very far. But at the same time, we need to understand how those tools can be helpful, but also how they can cause harm. And I think that that's kind of one of the things we're going through right now. As a matter of fact, you're in the IT area. I think you would probably agree that we're in the midst of a digital revolution. And we thought the Industrial Revolution, which occurred over the course of the 1870s to the 1940s, 1950s, both the first and second generation. And then we had the economic revolution of the 60s and 70s. And now we've got this digital revolution, which is going to occur over maybe 5 to 7 years. I mean, it's an incredible
Yeah,
speed with which change is happening. I know that I've already had the discussion with some young physicians about the impact of, for example, artificial intelligence.
yeah,
And one of the issues is, gee, are they going to replace us? And it's like, well, I guess that's a possibility if we let it. But are humans still important? Yes, they are. Matter of fact, I really firmly believe that there's nothing like the touch of someone to another person to make a difference. And that we need to learn that the human interaction and the use of the tool to help us do a better job is where it's at, rather than letting it simply replace, because computers make mistakes,
yeah.
you know?
And it can create chaos. We know with Arthur C. Clarke, the 2001 Space Odyssey.
Yeah.
But I think about the human desire to revert back to things that genuinely make us feel good, like the warm analog glow of vinyl.
Mhm.
Who would have ever predicted that vinyl albums would have ever come back in with the ease of digital music,
Yeah.
right?
Right. Right.
So it's
That's
that idea, right, of and I think that the problem with AI is that it doesn't have judgment. If you're in the operating room or you're in a tenuous situation,
Mhm.
AI is just going to go for just it's
It's going to
scripted. It's
do its
zeros and ones.
job. It's going to do its job that it's
Yeah,
pointed at.
yeah. So if something goes south and it can't monitor something that is happening, it's not going to stop. It's going to keep going. But as a human, you can, pivot and go. I think, and it's funny you mention AI because that's exactly where I was going. Are you seeing, aside from the fact that it can go south, is AI in a beneficial, healthy way doing good things for healthcare?
Oh, absolutely. As a matter of
Yeah,
fact, I really believe that AI is going to become an essential component of the way we deliver healthcare.
yeah,
The issue, though, is that we need to do a much, much better job of educating our healthcare professionals, not just physicians, nurses, pharmacists, social workers, anybody who's involved in healthcare, need to have a grounding in the use of digital technology so that they understand how these tools work, how they need to be integrated into the process of care delivery, and what the problems are when they break or they don't understand, and how to evaluate these tools. And we're not doing that. Out of the 144 medical schools that exist in the United States, medical and health science schools that exist in the United States, only about 30 of them have the capability for developing a core curriculum to educate the healthcare cadre of the future in digital health capabilities. And my contention is that learning about digital health is as important as anatomy, physiology, microbiology, all the other ologies that you can think of, that this is just as important and we're not even touching on it.
yeah.
Well, there's a problem. And, the curriculum committee say, oh, the curriculum is so full. Well, let's be flexible. Let's talk about how we can flex this tool so that it does get integrated into the curriculum. So that discussion is beginning to occur within healthcare. As a matter of fact, I've got a discussion with one of the senior deans of one of the medical schools who's interested in potentially getting involved in that kind of an initiative. So coming up. So
My IT work is in a school district and we look at it from a student perspective. And I
Yeah.
think there's a part of people that just don't know what to do. I mean, AI is not a part of the board policies. It's not a part of like any like firm law, but it's going to have to be. It's going to have to be addressed. It can't be villainized. I
Right.
mean, we can't just assume that kids are going to cheat. We need to allow them to harness this technology that, like you said, is making the Industrial Revolution look like eons
Yeah.
because AI is just moving at such a, I mean, every single day, Moore's law is getting trounced. Like it's not a yearly thing now. It's a daily thing where it's
That's right.
duplicating itself, you know.
Right. Right.
So I'm curious, who's been that inspirational force, that hero in your life that's allowed you to 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 be successful, to become who you are?
Well, there's an individual. He's passed away. It was Tom Johnson, who was the dean of the medical school that I graduated from. He became a very close friend. He actually opened the door for me in many respects by getting me involved in rural health. I set up the Center for Rural Health at the University of North Dakota, which at the time there was only one other program on rural health in the country, and that was in North Carolina. And so I got involved and set up this office, which over time became one of the premier rural health programs in the country. And it was in large measure because of Tom Johnson and the way he encouraged me and supported me. Um, so I would list him. Um, there are so many individuals that come to mind. I don't want to necessarily leave anybody out,
Yeah,
but
yeah,
and I also think that my family has been really important in helping me to maintain my focus and I've been very open with friends of mine, I guess is the right word, who have encouraged me to, be creative and to use my creativity in some interesting ways. Like I wear a whisk. I don't know if you've noticed that,
yeah.
but I wear a whisk and I wear it because it's been my symbol for, oh gosh, going on 30 years now, because I stir things up. And, that's my mantra. I
I
stir
love
things
it.
and so many people say, "Well, are you a good cook?" And I say, "Yeah, actually, I'm a pretty good cook. I like to cook." But the lesson that you learn about cooking is that if you stir too slow, things burn, and if you stir too fast, you make a mess.
That's
So
right.
you got to stir just right. And so that's one of the lessons I've learned.
Find the perfect bowl of porridge, that's for sure. So if you could meet one person, and it would be a ghost, somebody that made a medical advancement, maybe the first open heart surgeon, the person that came up with penicillin, um, a surgical procedure, a medical advancement, is there anybody out there that fascinates you with an invention? Or a revelatory idea that's become rote in medicine today?
Yeah, there's one that comes to mind, Asclepius. Asclepius was a Greek physician who really created the profession of medicine, is the way I would put it. And he did it by uh, using his observations about interventions that made a difference in people. And at that time, we didn't have any technology, we didn't have any of the surgeries, we didn't have anything really. But he actually did make a difference in people. And he did it through his observations about the way people ate, the way they engaged in activity, and et cetera. So I'd love to have the opportunity to talk with Asclepius. I don't think it'll happen, but that'd be a lot of fun.
That'd be cool. So let's say you have a dream tonight. You run into the 18-year-old version of you, and you walk into the room at your age now, and there's a film projector, and you click play, and your 60-second highlight reel of your life comes up on the wall. Will that young version of you believe your life turned out this way?
Um, yeah, I think it would. I mean, so one of the things that happened to me, so it's not when I'm 18, but just a bit older. I was elected president of the American Medical Student Association, which was an incredible honor. At the time, there were like 90 medical schools, and to be the president of one of the students around the country, it opened my eyes. I mean, literally within the first 2 weeks, I had the opportunity to go to the Council of Deans, which is the association of all the deans in the medical school, and to give a talk about how we needed to change medical education. I felt I was a bit intimidated by it, but I did it. And then I testified in Congress in support of the program to deploy physicians into underserved areas. So that experience really opened my eyes. But the reason I mention it is that as part of that experience, we had a retreat. And it was a retreat to help us determine what our future should be. And one of the things I learned is that to really have a focus of where you want to be, you have to have a purpose. And so as part of that retreat, we defined our purpose. And I defined my purpose as to make healthcare better. That was my purpose. And in fact, that has been the theme across all of my professional experiences throughout my entire career, whether I'm practicing medicine or working as a senior executive in a healthcare system. It's always been to make healthcare better.
Yeah.
And I think that having purpose in one's life is something that we need to encourage individuals to think about, because it really does help you keep your focus and to maintain direction and, in fact, to make a difference.
So in that 60-second highlight reel, what are you the proudest of? What are you the happiest about?
Well, I guess a couple of things. I very proud of the rural health program that I helped create at the University of North Dakota, which was a program not to be academic and study problems, but to help communities solve problems. And so we were a very activist organization that actually engaged with community leaders in helping them to recruit physicians, to look at their healthcare system, to, et cetera. So it was a very hands-on, reach out, solve problems kind of model. So that's one. I think another one is that I was very involved in the very formative stages of digital health use within healthcare, and have been one of the people that was involved in that whole movement and helping to make it a reality. So I'd point to that. And I'd also point to my clinical practice. So one of my things that I just learned this maybe four months ago is that I had this one delivery that is in my mind almost every day. It was a delivery where I almost lost the baby. I mean, and I just when I think about it, I just I sort of melt.
Yeah.
But we didn't lose the baby, and in fact, the mom was a nurse, to just make it even more complicated.
Wow.
The baby turned out great, and she evidently went to medical school, and she's now graduated from medical school, and she's going into practice as a resident. And I'm so proud of the fact that I was there and the first person to touch her and to deliver her, despite all the complications that were part of that delivery. And now to hear that she's now going on to medical school was like, oh, wow.
I love it.
Good.
That's beautiful. So if anybody wants to learn more about what you're doing, the Creo Network, any of the good business, where's the best place for them to go?
Well, they can go to Creo Strategic Solutions, all one word, CREO strategicsolutions.com. That would be the best place to go. And, you can connect with me as well, Dr. Kevin at CreoStrategicSolutions.com. So that'd be the best way to get in touch with me and to reach out.
I love it. Dr. Kevin, this has been wonderful, revelatory. Thank you, sir. Thank you for your wisdom. Thank you for taking a minute out today. Great to meet you.
Thank you, Joe. Yep.